Living in a small apartment in the St. Jamestown neighborhood of Toronto is the 85-year-old Joseph Allen. Mr. Allen is a retired elementary school janitor who is currently living alone. His wife passed away 2 years ago, and both his son and daughter live in Vancouver. Joseph Allen has been diagnosed with type 2 diabetes, hypertension, and suffers from obesity. He currently weighs 250 pounds. This is Paul, a PSW assigned to Mr. Allen. The care plan states to assist with light housekeeping, laundry, meal preparation, and provide medication reminders as Mr. Allen has recently started to struggle with cleaning and keeps forgetting to take his medication. When Paul arrives at Mr. Allen's apartment, he knocks on the door, but there's no answer. Paul knocks a few more times until he tries the door and notices it's unlocked. When he opens the door, he hears the distressed voice of Mr. Joseph Allen. Paul enters the apartment to find Mr. Allen on the floor. As a competent PSW, what are Paul's priorities in this situation? Safety first. Paul can provide a thorough assessment of Mr. Allen's injuries by asking if he hit his head or if he feels any pain. After Paul's thorough assessment, he sees that Mr. Allen has not sustained any injury. If a PSW did see that the client was showing signs of injury, they would call emergency services immediately. Paul does an assessment of Mr. Allen to see if he can bear any weight. Mr. Allen says that he cannot stand. A PSW knows that in the event of a fall, you should never lift the client. In order to get Mr. Allen off the floor, Paul needs to contact the supervising nurse and get in touch with emergency services. It is important for a PSW to remember to follow the workplace policy and procedures set up. When speaking to Mr. Allen, Paul remembers to use therapeutic communication. Keeping good communication is essential when it comes to safety. By using communication methods found in the Sorrentino textbook for the support worker, Paul knows that it will effectively help in reassuring Mr. Allen and providing him comfort. Paul uses active listening by leaning down to face Mr. Allen while making eye contact. This will provide dignity and respect. Paul prioritizes safety by implementing key fall prevention practices like clearing clutter, improving lighting, and ensuring assistive devices are within reach. Paul has effectively prioritized safety by providing comfort with communication, following falls procedures, and adhering to his workplace policies. Paul has successfully managed Mr. Allen's situation. With the assistance of paramedics, Joseph Allen was helped up onto his feet. Mr. Allen was not injured, so there was no need to go to the hospital. Time management. Time management is a crucial role in completing priorities of care, especially after the client has experienced an unexpected fall. With careful consideration of his 2-hour time limit, Paul plans his time to be sure all care is provided, as he knows it will reduce the risk of future incidents or injury. Paul's plan includes 10 minutes to spend doing a safety check and speaking with Mr. Allen to get an understanding of his emotional well-being, 25 minutes on light housekeeping, and 15 minutes on laundry. He schedules 40 minutes for meal preparation, 5 minutes for medication reminders, 10 minutes for a home safety check, and finally 10 minutes for documentation and wrap-up. Paul gives a large chunk of time for meal preparation as he knows that proper nutrition is required to effectively manage Mr. Allen's diabetes. Paul uses ingredients that focus on providing the client with a diet that is high in fiber, low in sodium, avoids processed or sugary foods, and creates meals that are easy to both chew and cook. Paul's plan to organize his schedule, prioritizes Mr. Allen's safety while showing Paul's understanding of nutrition and the impact towards the client's health conditions. During Paul's next shift, he arrives at Mr. Allen's apartment when he notices the expression on Mr. Allen's face. Paul recalls what he has learned about nonverbal communication as he takes a mental note of Joseph Allen's body language. When asked if everything is okay, Mr. Allen responds in a frustrated tone and disclosed concerns about his neighbor possibly taking his money and groceries. A PSW's scope of practice. As a PSW, Paul knows the importance of recognizing the signs of abuse and the different ways an older adult might experience abuse. In this situation, a PSW's ethical responsibilities are to listen empathetically, document any exact words, report to the supervisor immediately, and avoid confronting the neighbor or investigating on his own. This aligns with the OPSWA's Code of Ethics, ensuring that a PSW will work within their scope of practice and protect client safety. When providing medication reminders, Mr. Allen also reported receiving a new insulin pen from the pharmacist but has since forgotten how to use it. Even if Paul remembers how to inject the insulin, he should not do it himself. Instead, he should request Mr. Allen to get help from a nurse or other member of medical staff. In order to follow their scope of practice, a PSW can only assist with medication. They cannot administer unless delegated and trained by a regulated professional. Promoting a healthy lifestyle. Considering Joseph Allen has been diagnosed with diabetes, hypertension, and obesity, Paul can encourage many different lifestyle strategies. Nutrition plays a huge role in promoting a healthy lifestyle for Mr. Allen. Having a well-balanced, low-salt, low-sugar diet will help him manage these health conditions. Daily safe exercises, hydration, and taking medications regularly are steps in a healthy lifestyle for older adults. Mr. Allen also expressed feelings of loneliness. He says he spends so many days home alone and wishes he had more to look forward to. To respond and address Mr. Allen's feelings of loneliness, Paul suggests checking out the community center best known as The Corner at 240, which offers programs for seniors specific to the demographic in St. Jamestown. He also encourages to look into the services at Baycrest, as they offer a wide range of health and social programs for older adults. By encouraging a healthy diet, exercise, and community support, Paul promotes social connection, physical activity, and emotional well-being. This implements the core principles used in community-based care.